Welcome to Built in the BLuegrass, a podcast dedicated to cool stuff made in Kentucky. We want to share with you how it was made, why it was made, and the story behind it. And now, here's your host.
Hello, everyone, and welcome to another episode of Built in the BLuegrass. We're switching it up again on you all today. Our usual host, Griffin Meredith, he is out of town on vacation with family. And I am your EP, Tom Lawson. I'm usually behind the scenes, but today I am your host. And we have a pretty good one here for you. We have Advanced Solutions across from us today, and I will let the CEO of Advanced Solutions introduce himself, go into a little bit of depth of what they do and, kick it off for us.
Great. It's great to be with you, Tom. So my name is Michael Golway. I'm President and CEO of Advanced Solutions. Advanced Solutions was incorporated in 1987 in Louisville, Kentucky, and that's where the headquarters remain today. I actually had an opportunity to acquire the company in 2004, and we today operate 5 businesses within Advanced Solutions. One of the companies that is a focus today is our Advanced Solutions Life Sciences, and that is the business where we manufacture a robotic platform that we call Bioassembly Bot. You'll hear me refer to her as BAB. So whenever you hear BAB, it's the Bioassembly Bot, but it's a robotic platform that we design and manufacture in Louisville, Kentucky, that we're teaching to 3D print human organs.
Yeah, that's cool. I did look up a little bit about BAB, and I did see that you were doing did you call man-made, artificial? What would you specify those as?
Well, so we are actually using human cells as the raw material to build the new 3D printed tissue, whether that's a tissue replacement or an actual, ultimately the goal is a human organ. There's been a very long technology path that we've been on to achieve that goal, and we still have more milestones to go. But since we've been involved in it since about 2010, when the idea first came about, we've seen an incredible evolution of the technology and the advancements, not only on the hardware side, but also the biology side. So the end goal is that if you have a diseased or damaged tissue in your body, that we can actually harvest some of your cells as raw material and then use those cells to actually build a replacement.
Yeah, that's a very in-depth level of manufacturing that we haven't talked about on Built in the BLuegrass. Kind of the soft tissue. We always talk about raw materials as metals or wood or plastics, but not human cells. That's pretty fascinating, really. You say you make BAB here. Do you sell BAB to other companies so that they can do their own research and designs and things of that nature?
We do. We intentionally designed the robotic platform, so that we could get it in the hands of really smart researchers, doctors, scientists around the world. When you think about the goal of being able to 3D print replacement tissues for humans, everybody on the call can appreciate that's a pretty ambitious goal. And so it's not one company that can solve that. We recognize that early. Our skill set was really in the robotics and the software, the artificial intelligence, and even the biology in in a way that we combine that subject matter expertise to build this platform. And we then sell to others around the world, really to allow them to translate their expertise. We've got customers that have spent their entire careers focused on the human eye, as an example, or the heart, or so you have these really fantastic specialists around the world that have progressed, ways to build replacement tissues. And so with BAB allows them to do it easier and in a way that translates their science to something that can be used in a clinical application.
Gotcha. And what have you, obviously, you've probably seen some successes. What is one of the biggest successes you've seen from BAB thus far?
So we had, when I talk about the journey, it's so exciting to see. And when we first got started, one of the first capabilities that we taught BAB was the 3D printing capability. And she actually has a 6-axis robot arm, which, if you think about your human arm, you have 7 degrees of freedom that you can move. Our robot has 6 degrees of freedom, so very similar to a human arm. But if you just think about how with your human arm you can reach and you can grasp and all the different configurations and positions you can put your arm and your hand, we have a similar capability with BAB. And that gives her a lot more flexibility. When you're talking about manufacturing organs or human tissues, the assembly of those cells is really critical. And it, traditional 3D printing is XYZ, so three degrees.
Right.
BAB gives us 6, which is a lot more flexibility. And so if you translate that into some of our customers, some of our early customers actually purchased the platform for their research work in a university setting, as an example. And we've now journeyed far enough down the road that some of those researchers have actually started up commercial companies where the research has translated into something that represents a commercial success. So we have a customer in France, as an example, that started with us back in 2017. They had an objective of 3D printing human skin in a way that would help 3rd-degree burn patients. This particular lab, it's such a great story. This the doctor that was heading this lab really had a passion around helping all 3rd-degree burn patients, but in particular children that had 3rd-degree burns. And when you visit his lab, you spend 5 minutes and you know exactly what the mission is. Everybody in the lab is focused on finding this solution. And so they used BAB to help translate the assembly protocol of the cells and the recipe, if you will, about how to do this so that you get human skin. And so they have a commercial company now, and they have since bought some of our newer BAB platforms that are designed more for the clinical commercial applications. So that's an example. We have another customer in the US, that same story. They started out in the university setting. They have a company now that is attempting to 3D print neural guides for brain implants that represents a potential cure for Parkinson's.
Mm-hmm.
So there's several of those that have started to pop up as our journey has continued. And that's really extremely satisfying, because when we first got started, the idea in 2010, you could begin with the end in mind and see what a wonderful impact this may provide for humans. And then in 2024, you start to see some of the benefits of so some of that translate into actual commercial success. It's very exciting.
Yeah, it's When I did the research on BAB, it was like, well, they could do organs. They could do. It's one bot that you can really tell it to do anything.
Well, it's a very perceptive insight into the platform. That's what we designed BAB to do. So I'm just a quick background. I'm a engineer, graduated from the Speed School of Engineering 30 years ago, almost 31 years ago in 1993. When I came out of Speed School, I had a opportunity to get involved with robotics early on. And one of the frustrating elements of robotics at that time was that they were not very flexible. And so you could take a process and you could put a robot in and you could automate a system, but if the business changed, the workflow changed, it was very frustrating for customers. So I'm really humbled that I've lived long enough to see the technology evolve where we could bring to life a platform like BAB where she can actually learn and adapt as things change. And you can appreciate that with biology, no two projects are the same. So if I may share another story, another one of our customers, Dr. Doris Taylor, her lifelong subject matter expertise is around the human heart. She actually invented a way to take a cadaver human heart, pull out all of the biology of that heart. When you take that step, what you're left with is the shell of the heart. There's a protein structure of the heart, and it maintains all the valves and the chambers. It even has the vasculature that remains, but there's no biology in it. They call it a ghost heart because if you hold it up to the light, you can actually see through it. It's very jellyfish-like.
When you say biology, it's kind of, do you mean more like DNA within?
Yeah, exactly. So all the cells that were previously in it, she developed a process where all of those cells are removed, and it's just left with the protein structure.
Yeah.
Now here's the amazing part. She took the next 12 years to painstakingly figure out how to inject stem cells in the right quantity in the right place inside that ghost heart so that the cells would come to life and that heart would come back to life. And as you might imagine, those stem cells are from the patient of the heart of the that is going to receive the heart. And so a couple of years ago, she was actually on stage demonstrating where she had successfully done this with a 50-gram human heart, which is the size of a child's heart, and had taken it all the way through that process and actually had it beating. And so you might imagine an adult heart is much different in size than a child's heart. So an adult heart might be more 175 to 200 grams. So the story and the connection with BAB is Dr. Taylor actually taught BAB the recellularization process. Those 12 years that she went through painstakingly figured out the right quantity of cells, the right place. And now BAB can take any size heart when it comes into the workstation. We actually equipped BAB in that particular application with ultrasound. So BAB can actually see inside the heart, and she can guide the injection of those stem cells in a way that it lends itself more to mass production of that technique, which ultimately is the goal, right? It's if you can get a process that is low cost in manufacturing, high quality in capability, the ability to personalize it in a way that you can use your cells to rebuild your heart. Those are all the check boxes that you want to have if we're truly going to realize replacement organ applications as a whole. And so I think it's a great example of how BAB can bring that next connection point to help facilitate that more mass manufacturing, as opposed to the painstaking effort that she has to do manually in the lab. We can now systematize that and mass produce it.
This is Frank Jimley with the Kentucky Association of Manufacturers, proud sponsor of Built in the Bluegrass. For over 100 years, CAM has served our state's manufacturing industry through advocacy, workforce development, education, and training, as well as cost-saving benefits for members. Fighting for manufacturers is what CAM does best, representing the industry in both Frankfort and in Washington, D.C. Whether it's advocacy, offering discounts, or group health insurance, CAM has its members covered. Learn more and become a member by visiting cam.us.com.
That's one of the more fascinating things that I've seen come through, not just on Built in the Bluegrass, but something that I just haven't really thought about outside of, you always see the when you do your license, you're an organ donor or something like that. So being able to manufacture or replicate almost DNA, take out DNA, put new DNA in, that's a whole new part of them, I guess, I don't know, manufacturing and medical field that I haven't thought of previously until now, really.
Well, it's crazy to think about. I just think it's so, I'm honestly humbled by the time that we live in human history. We're living in a time that the technology has evolved to a point where we can actually put the technology together in a way that can really solve some tough problems that has plagued humans since we've been around. And it's really fun to be able to participate in that.
Yeah, the some of the groundbreaking innovation this year have been pretty crazy. Like you were saying with the, Parkinson's and the brain implants. I mean, recently we saw Neuralink patient one, I think they call him patient one. He's doing great, and I'm sure there's going to be more people that want to do that based on what they're seeing from him. But yeah, that's kind of it's been a lot of groundwork, it sounds like, to even get to this point where those applications really coming out.
I think it's a fantastic point. I'll share this one little tidbit with you and the audience. You just take the robotic arm that we use. That was the first industrial robot was actually patented in 1954 by a gentleman by the name of Bill Duvall. And that patent was, it wasn't until early 1960s that he was able to get a company to actually implement the idea. He had General Motors invest in the idea of an industrial robot. And the first one was the size of a large dinner table. It weighed 4,000 pounds. It did a couple
Printing
things.
Press.
Yeah, exactly. It moved apart from point A to point B, and it did a little bit of spot welding. It turns out that George was born in Louisville, Kentucky, which is, I think, interesting. Little point, trivia point that connects BAB back to Louisville and Kentucky. But you think about 60 plus years of the industrial robot. You and I grew up in an era where robots started to become commonplace. They proliferated the planet. You couldn't go into a manufacturing plant without seeing one. And so, but it it's easy sometimes to look at 60 years of innovation and see the end result and maybe not appreciate the 60 years of failures that happened. And
Oh yeah.
we're benefiting from all of the failures and successes of the industrial robot. And it just so happens in 2024, the robot has gotten small enough, the technology's gotten more, capable enough that we can assemble it in a way that we can actually teach it to start recellularizing a human heart. I mean, and that's not the end. It's just another step in the journey with any of these, whether it's the Neuralink or, it's just the way the technology evolves. It progressively gets better and better, and it gets faster as we go. Sometimes it's dizzying to me just how fast technology moves.
Yeah, I was, not to get off track here, but I was watching a TV show the other day, and they were just going through one of the parts that was scripted was how long did it take humans to get to the, you know, out of the hunter gatherer stage into the industrial stage into different phases, and those timelines get shorter and shorter by decades now that we're, out of the infancy stage, I guess, of being hunter gatherers. Now we're in this really bright spot of all the culminations of technology and software, uh, have come together rather quickly. I would say uh, I remember when I was younger, we had Nextel cell phones that had a walkie-talkie built in. Now it's basically a computer in our hand. So very short time period from then to now, and it's only going to get, I don't want to say crazier, but kind of crazier to think about, and better and more sophisticated with a lot less, better tolerances on, whatever that machinery or platform is supposed to do.
I love how you said that. I mean, you just think about the 30 years since I was in engineering school. When I graduated engineering school, we didn't have email,
Yeah.
we didn't have cell phones, we didn't have social, media, any of those platforms. Google wasn't around, and so the nature of the evolution of technology, if you take what has evolved in just the 30 years since I've been out of engineering school, we're going to see that same level of innovation and technology advancement, not in 30 more years, but in about 10 years, which is really amazing. I mean, that's what's going to enable us to get across the finish line and solve some of these tough problems in our lifetime. That's the important thing for me, because we don't have forever to live, right? And so
Right.
it's incredibly exciting that we have an opportunity to participate in that technology evolution in a way that we might be able to realize our goal in our lifetime. And that applies to whether we're going to space or any of these scientific innovations that you see in the world today. They're all moving at that exponential pace.
100%. All right, let's get back to advanced solutions a little bit. And you all started in Kentucky. You stayed in Kentucky, here in Louisville. Why have you stayed? What keeps you here in Kentucky? And
Well,
give
it's
us a little
home for
background on
me.
that.
Yeah, it's home for me. So I'm biased from that standpoint. I love Kentucky. I've been very fortunate to have the opportunity to travel around the world, and there are some incredible places around the world. There's also some really tough spots in the world, and I personally, every time I land back at the Louisville International Airport, there's this feeling of just, I'm so glad I'm home. It's just a great part of the world. It's one of the great spots in the world. And so it's a little bit biased from the standpoint it's where I grew up. and was raised. But I, as I indicated, I do have that that other side of the coin where I've had a chance to go see other parts of the world, and every spot in the world has its pros and cons. On the whole, I just think Louisville and the state of Kentucky is not a bad place to hang out.
It definitely isn't. All right, Michael. Well, I think we're going to wrap it up. I appreciate you being on today. The conversation was very different from what we usually have, and I appreciate that.
Oh, it's my pleasure.
All right, everybody. Thank you all for joining today, and we will see you next time.
Thanks so much for tuning in to this episode of Built in the Bluegrass. We hope you're leaving this episode with a better understanding of the cool stuff made in Kentucky. If you haven't done so already, make sure you're subscribed to the show. This way you'll get notified as new episodes become available. Until next time.